15, and I currently specialize in dermatology. So I'm looking forward to talking with you all in a few.
I guess I'll go next. Hi, everyone. My name is Yawande. People call me Wande for short. I am a first-year PA student at Towson University, CCBC. And I graduated from Towson University as well for undergrad in 2016 with a bachelor's in biology.
Good evening, everyone. My name is Rashada Jordan. I'm currently a physician assistant practicing in psychiatry and addiction medicine here in Virginia. I'm fairly a new graduate. I graduated 2 years ago from Francis Marion University. I was a part of the inaugural class. And a fun fact about me, I would say I'm definitely into photography and film. Anything IT, technical, geeky type of stuff, that's me. So I'm glad that you guys are on here this morning. I look forward to speaking with you guys soon. Not morning, evening, sorry.
So I guess I'll go ahead next. My name is Lamont Hunter. I'm an emergency medicine PA here in California. I've been a PA for about 15 years. Worked primarily in emergency medicine. I'm lead PA for Cottage Health, which is a small hospital system here in Santa Barbara. And I'm happy to be here with you guys.
All right, so I'll go ahead and start. We're just going to talk about just kind of the introductions to the PA profession. And then I'd like to just do a formal introduction for myself and just really welcome you all here this evening and just thanking you for taking your time to come to this Zoom panel event. I really look forward to sharing some of my experiences about my PA journey and hopefully providing you all with some useful information towards yours. As we all know, representation matters, especially in our profession, and it's such a privilege to be on this panel with a PA student and other PAs of color. So I wanted to start by asking you all a question, and that is, why are you interested in a career as a PA? And I would love if you felt comfortable leaving your response in the chat. I think it would be useful for other participants on the Zoom as well. So I'll leave a little time for that. But I wanted to ask that because I think it's important to think about this now, especially if you're wanting to pursue a career as a PA. It is a huge time investment and financial investment as well. And also you'll need to start to articulate this when it's time to write your personal statement and do your interview. Let me see, is anyone, okay, so everyone's, don't be shy. Y'all share why you want to join. Okay, I'll continue. So I'll start with so Jasmine said to be able to learn and grow, I'm gonna read hers, and serve in a variety of specialties. Good, I'm actually gonna touch on that later. So as you all type in your responses, I'll share my own personal reason. And to give you a little bit of background on me, my first introduction to a healthcare career was through my mother. When I was about 9 years old, she was going to school to be a medical assistant, and she would bring home her textbooks, and I would find myself like flipping through the pages, really interested in the science and the pictures that I was seeing. And this really intrigued my interest in science, and that continued throughout middle school and high school. Really growing up, the only healthcare profession careers that I knew about was a nurse or a doctor. And by age 14, I had decided that I wanted to be an obstetrician, and I told everyone, like, I want to be the doctor who delivers babies. And it wasn't until I was 16 and I nearly fainted watching my mother give birth to my sister that I decided that becoming an obstetrician was not the path for me, but I still wanted to pursue a career as a medical doctor. And so I aligned my undergraduate studies, my major, and everything to prepare me for medical school, to have a competitive application. And fast forward to my junior year in undergrad was when I had my first exposure to a PA. At this time, I had been struggling with really severe acne. It was the worst that it had ever been. And so I was trying to make an appointment to see a dermatologist. And the front office receptionist informed me that it would be a 2-month wait to get into the dermatologist, but the dermatology PA could see me in 2 weeks. And initially, I politely declined. I wasn't aware of what a PA was. I didn't know if she could prescribe medications, what her scope of practice was, or what her abilities were. But after she just kind of reminded me that I would have to wait 2 months to get in to see someone, I eventually agreed, and I'm so glad that I did. She was extremely compassionate, very knowledgeable, explained everything in detail at the time, why I was dealing with acne and the treatment regimen. And I left feeling really hopeful about my acne improving, but also intrigued about this newfound career as a PA. So during the process of me having follow-up visits with her, I would come back with questions, and she was extremely gracious and answered them all. And the more research I did, the more I felt like this career aligned with my own personal values. And I want to just kind of outline a few things that really attracted me to the PA profession. One of them was that I could work in the same capacity or a similar capacity as a physician, having authority in the management and treatment of the patients that I saw. The second thing, which Jasmine stated, is the ability to work in a variety of specialties. And as a physician, I would have to go through medical school, choose a specialty, do a residency in that specialty, and train for many years to become an expert. And if I decided that I no longer had a passion for that specialty, or I wanted to switch, I would then have to go back through formal training again to do so. And so having the ability to kind of pivot and work in multiple specialties at the same time, or leave a specialty without needing formal training again, was definitely a benefit for me. Then also shorter schooling with PA education meant that I could enter the workforce sooner and start generating a respectable income. And then finally, less debt. I went through a couple of forums, I read some surveys, and it said the average PA will pay back roughly $150,000 over 20 years, and that's with like a 6% interest, versus a medical doctor, they will pay back approximately $300,000 over a 20-year period, assuming that same interest rate. And so once I became really resolute in my decision to become a PA, I started to explore PA programs and created a list of basically high priority items for me. What was really important in my ideal PA program? The number one thing was staying in state for me. I'm from Illinois, and I realized that in order to not have as high of a tuition, getting in-state tuition would also help. I also looked at Texas. I don't know if you all are aware, but Texas has some of the lowest tuition rates for medical school and PA school. And so part of me wanting to stay in state was the fact that it's no secret that PA school is extremely challenging and demanding, and I wanted to be close to friends and family and vice versa. So if I was going through anything or needed a break, I did not want to have the burden of a plane ticket to get back and forth to family. And then secondly, the PANCE rate. If I'm paying and investing so much money to get an education, let me back up. So the PANCE is the exam that PAs are required to take to become certified. So once we graduate, we all sit down for this certification exam. And so I looked for programs that were basically the best of the best. They all had 100% first-time pass rate for their students in graduating. And the second thing for me was, the third thing rather for me was location. I really like to be outdoors. I like to explore. I like to have a lot of activities near me, and knowing that I was going to be going through a difficult program, I wanted to make sure I was at a PA program that had the location. I could go hiking or visit wineries or do, when I did have the free time, be able to do activities that I enjoyed. And finally, curriculum for me was huge. When I discovered problem-based learning, I really knew that that aligned with my learning style. And problem-based learning is basically an interactive way of learning. It's student-focused and student-driven, really. And you start with a problem and you work in a team setting using critical thinking skills, self-directed learning, and basically collaboration to figure out a solution with new skills and knowledge that you acquire. And this really sets you up to go out into the workforce as a PA to do the same. As a PA, we collaborate with physicians, other PAs, nurse practitioners, nurses, social workers. So having that skill already being built and that foundation already being solidified was definitely a positive for me. And so finally, with my search, I landed on SIU being the best program. It checked all the boxes for me, honestly, and that really solidified it for me on interview day. It was very laid back. Although I was extremely nervous, I could tell that they really wanted the interviewees rather, to feel confident, to feel comfortable, and that it was just really low pressure. And once I got accepted into the program and became a student, that was really affirmed for me that this was such a family setting. Even within my class, I didn't feel that there was competition. I felt that the faculty and the staff were always accessible and that I could ask any questions during any time of the day that I needed. I remember emailing one of my professors at like 10 o'clock at night, and she responded back with her cell phone number for me to call her. And so just having that type of support when you're in a program like that is extremely valuable. And so finally, I'll close with saying I'm extremely proud to be a PA. I feel like since the commencement of the PA profession, like we have stood in the gap and really stepped up to address healthcare needs. And events like this really help to bring awareness to our profession, really highlight the work that we do and the fact that we save lives. And we really want to focus on improving diversity within our profession and breaking down the socioeconomic barriers that prevent students like you all from getting into PA school and being able to complete a PA program. So I hope that this introduction has been really helpful, and I will pass the screen along to Wande.
Hello, everyone. So I have a small presentation on the requirements of PA school. I'm going to go ahead and share that with you guys now. All right, so the requirements for PA school. So I just wanted to start off by just talking about a little bit about my stats. So my overall cumulative GPA was a 3.45. My science GPA was a 3.39, and my GRE was a 297. For my medical experience hours, total, both health care and patient care, was 3,100 at the time of applying. And my volunteer hours were around 292. And so when we're talking about the process of applying to PA school or the requirements for PA school, I like to summarize it in about 6 steps. So we have the prerequisite coursework, we have medical experience, we have the standardized testing, which is the GRE or the PACAT. We have letters of recommendation, CASPA, which is the central application for applying to PA school, and then we have the interview. So first things first, most programs require a B or better in Gen Chem 1, Human Anatomy 1 and 2, biology, which is a prerequisite for a lot of other biology classes. So the intro to bio and microbio, and then intro to psychology and statistics. And then depending on which program you want to apply to, there's other courses that you may have to take, like medical terminology, organic chemistry, which is the prerequisite for biochemistry, abnormal psychology, and genetics. And for most programs, you'll find that their minimum GPA is a 3.0 to a 3.2. But if you're at a 3.5 and above, you'll find that you'll be more you'll be more competitive. So a couple of patient care experiences, which is different from healthcare experience, whereas patient care experience, you need direct patient contact. So a few positions would be medical scribing, a medical assistant, phlebotomist, research assistant, which could also be considered as a healthcare experience, paramedic, EMT, registered nurse, physical therapy assistant, home health aide, dental assistant, athletic trainer, surgical technician, and certified nursing assistant. So I know a lot of these positions you may need a certificate for. So the PA program, a lot of times you'll find that students, this is kind of like their second career path, and they had other careers before entering PA school. So obviously, a registered nurse, you have to go to school for that. Dental assistant, you have to go to school for that. But if you're a student and you would like to get a jump start on your patient care experience, you could do a medical scribing position, which they will train you on the job on how to do that. Or some medical assistant positions, they will train you on the job as well. So some healthcare experience positions are medical receptionist, pharmacy technician, clinical research assistant, and coordinator. So these are positions where you don't necessarily need direct patient contact, but you're still in a healthcare setting. So, and most students will have about 3 years of medical experience in total, whether it's healthcare experience or patient care experience before entering PA school. But the application to apply for PA school usually would recommend like a good number of 1,600 hours of experience combined. And then we have volunteer experience. So you can get this in any which way. You can do community service, Peace Corps volunteer, Red Cross ambassador, which is something that I did. Hospital, I did that as well. Just let's say transporting patients from different departments. Internships, which is a good way to get experience because they kind of train you on the job on how to do certain things and you don't have to pay for it. So I did about 2 of those. And the application would like to see around 200 to 300 hours of volunteer experience. And then shadowing experience. Not all schools recommend it. My school that I currently attend doesn't recommend it, but it always looks good because you always, most times people apply to more than one school. So you can, shadowing a PA is really great. And shadowing across different specialties is even better. So like emergency medicine, pediatrics, women's health, etc., like anything, because they would like to see that this is not something that you just thought about like the other day. You've put yourself in the positions to see how PAs work on the healthcare team with other healthcare professionals. And this is, the CASPA likes to see around 100 hours of shadowing experience. I personally worked in emergency department and also worked in a dermatology clinic where I worked with PAs, so I didn't necessarily have shadowing experience, but I was able to observe other PAs and how they interact with other professionals, and I did include that in my application. So standardized tests, we have the GRE and the PACAT. So the GRE is the one that is most common. Not all schools require it. And this is the graduate record examination. So the combined score of at least 300 is more preferred. So verbal and quantitative, each section is around 150 to 154. That's kind of like a good range that you want to stay at. 310 and above is very competitive. You want to try to be in the 50th percentile of each section. And for the analytical writing portion, the highest score is a 5, and getting around a 3.9 is pretty good. The PACAT is a test that recently came out last year. So this is the Physician Assistant College Admission Test, and it's about 180 questions, 12 subjects, anatomy and physiology, genetics, sociology, biochemistry, kind of like just it's testing you on what you were supposed to take in undergrad as your prerequisites. So it's currently in the the experimental phase right now. So it's really not required for you to take it like before applying to PA school. They're kind of using it as when you're going on interviews, maybe you'll take it then, or after you get accepted into PA schools. Some PA schools are using it just as they want all their students to take it so they can kind of compare your score to other people in the program. But they're not really using that to enter PA school yet. It's the GRE, and some schools, like I said, don't require that. And then letters of recommendation. So you're allowed in the CASPA, the PA application, to upload 5. A lot of schools just want you to upload 3. And this can come from someone who practices in the field of medicine, so a PA preferably, a medical doctor, nurse practitioner, nurse, someone who has seen you interact with patients in the workplace or volunteer setting. So this can be a manager or coordinator, medical doctor, PA, anyone that fits that description. Someone who supports you as an applicant. So maybe a professor, an advisor, a mentor. I know I had my organic chemistry professor write one of my recommendations because I always went to her office hours. She kind of knew like my plans and what I wanted to do in the future after I graduated. So those are some examples. Someone who has known you for some time, at least a year. So this could be anybody that I just mentioned. I applied with 2 PA recommendations, 1 organic professor, and then 1 medical doctor in the place that I volunteered. And also when you want to request recommendation letters from anybody who you're requesting letters from, it's always a good idea to also send them an updated resume so they know what you've done in the past, and kind of also set a meeting with them just to discuss like what you would like them to talk about on your behalf, like your relationship with them, what you would like them to include, kind of like guide them in a way in your letter of recommendation. All right, so the CASPA, it stands for the Centralized Application Service for Physician Assistants. And this is an online application where you describe your healthcare, patient care hours, volunteer experience, you enter your prereqs, upload your transcripts, and also write your personal statement. So for your personal statement, it's around 5,000 characters. You can't go above that. And this should address why you want to be a PA, your interest in medicine, and what makes you unique. You want to be original. So, don't worry about what the next person is writing. Don't psych yourself out by going on these forums and, not thinking that what you've done in your experience is enough. You definitely want to have experience, but the PA school wants to know like what makes you different, what makes you original, and this is your why. You'll also enter your healthcare and patient care hours. So you don't just want to list what you did in each experience, but you want to describe what you learned and how it's valuable. And then it opens every year around April. And so you apply the year before you would like to start PA school. And that's how that usually works. And the earlier you apply, the better. I know there was a rule of thumb where the J months are the best, so like June or July. But if you have a GPA, I would recommend if you have a GPA that is not at least a 3.5, 3.6, it's best to have your application in as early as possible. Then this is my favorite, finding a mentor. So utilize, we're in a pandemic, so it may not be as, easy to find a mentor or shadow like in person. There's a lot of virtual events just like this one. So just use social media to connect with current PAs or PA students. And they will just kind of like guide you on just the process, like what to expect, if they have any study tips. And they're just someone that you can always talk to when you're feeling like maybe you're having imposter syndrome while you're in school, or you're having doubts about your application, or you need someone to take a, double look at your personal statement. I feel like this is a very important thing. And I don't think I mentioned it in my introduction, or maybe I did, but I'm a second-time reapplicant. And so I believe that if I had a mentor, if I knew more about the profession before I applied the first time, I probably would have gotten in the first time. So I think having a mentor is very important. And then last but not least, interview day. So you submitted your CASPA application. They want you to come in for an interview. Your interview starts the moment you step on campus. So you want to greet everyone when you come in contact. You want to greet everyone you come in contact with, because you don't know who they are, if they're a student, if they're going to be one of the people interviewing you during your interview time. So you just want to be your best. Remember, the school wants you. So you're already in the door, you're qualified, they see your grades, you're basically already in. They just want to see if you're a good fit for their school. So be confident, show your interest in their school, and just try not to be nervous, which is easier said than done. I felt like I was more confident in my second interview than my first interview. You may have current students, be there on the day of your interview. And usually they may show you around the campus, be there to answer any questions. I feel like some good questions to ask would be if their program is a competitive or collaborative environment, what maybe their favorite course is and how they study for it, opportunities to learn with other health professions. And then during the interview time, sometimes it's one person, sometimes it's a couple. I know on my interview, I had 3 people interview me, and they each had probably about 3 or 4 questions each. So you just want to be prepared for that. And I know that I think we'll talk about some resources on how to prepare for interviews later on. And my tips would be to apply early, find a mentor, and keep track of your progress. So take off the classes that you've taken that is a prerequisite for PA school. If you want to start getting your patient care, volunteer, or whatever hours while you're in school, just keep track of that. And don't be in a rush, or don't feel pressure that everyone is doing something and you're not, because the average oldest person in PA school is around 40, and the youngest is around 25. A few people enter PA school like right after graduating from undergrad. And then a lot of people, like I said, is their second kind of like career change. So a lot of people are around like 25, 27 and things like that. So yep, these are my credits and references. And thank you all. If anyone has any questions, free to ask me, but this is the end of the presentation.
Okay, so as I mentioned before, I'm Lamont Hunter, and I was asked to just want to share some tips about surviving PA school, and some advice on how to ensure that you'll be successful when you get there. So for me, I can probably, and I think my other fellow panelists would agree that PA school is a time that was probably the most challenging but enjoyable experience that I've had in my educational life. The average PA program lasts about 27 months, and it's divided into a year of didactic classroom learning, followed by a year or so of clinical training that it takes you through different rotations and different medical specialties. My PA school experience was quite different than my undergraduate experience, in the fact that in undergraduate you have different people from different walks of life that are all pursuing different avenues. But once you get to PA school, I think everyone's focused on one specific career, and we were able to go along this journey together to get through it. Kind of one line that's been used to describe PA school is kind of drinking out of a fire hose. It's a lot of information in a short period of time. So one tip to survive the didactic year is to really figure out your studying patterns and your strategies to make sure that your studying is as quality as possible. It's a little bit different in the fact that it's not about the quantity of studying. It's about utilizing your time and being organized to make sure the time you spend studying is optimal, because time is something that you don't really have, and a lot of the learning is very quick, and so you have to really spend time organizing yourself. So for myself, my first couple of classes in PA school were the most difficult, because it took some adjusting to the rigors of PA school. So it took I think I had a rude awakening after the first couple of classes, like, oh, this is what I have to do now. And then once you get your bearings, I think it's easier to be successful. Another big tip that with this rigorous PA education is that I think you all have to realize that this journey is your own. It's no one else's, and so figuring out what works best for you and figuring out ways to balance your own personal life with the rigors of PA school is going to be really important. Self-care during this time is very important. And I had classmates and others that went through a lot of divorces and family issues, and had a lot of other things that still continue even when you're in PA school, but making sure to foster those relationships, and making sure that you have your support system in place to help you through those times when things are a little more difficult is going to be really important. I think the learning is a little bit different than in undergraduate, in the fact that you're learning for your job and for your career. So taking the time to actually learn the information and not so much focusing on the grades. I mean, the grades will come if you spend time and work hard, but ultimately it's, the goal is to really learn the information. And it can be difficult in a short PA program to learn it all, but keep your focus on the learning part, and the rest will take care of itself. The grades, I mean, obviously you want to pass your classes and do well, but focusing on getting straight A's in PA school is shouldn't be your goal. The goal should be to really learn what you need to learn, so that you can help your patients, which is ultimately what we all did this for and do this for. As far as the clinical year, that's where PA school, I think, is fun, and turns, where your program changes and where you are able to work in different specialties to kind of to sample and figure out what specialty works for your personality and what could fit in your lifestyle. So for me, in emergency medicine, it was a specialty that even during my clinical year, I definitely gravitated toward it. The culture and the people and, the teamwork that's required for emergency medicine really appealed to me. The lifestyle is nice. You work a lot and then you're off. You can work days and nights. And so that all appealed to me. But that initial exposure was during PA school. For some people, you may hate that lifestyle. You may want something that's, 8 to 5, Monday through Friday, or whatever it may be, to have a regular schedule, and that may fit your lifestyle a little bit better. But the clinical year is when you can sample and really learn what you really enjoy. I always tell students that the clinical year is great in the fact that it's the time where you can learn a lot and spend a lot of time without the liability of actually being the person that has to take care of the patient completely. So that's your time to dive in and really experience things. And for the clinical year, I really believe you definitely get out of it what you put into it. I mean, I had classmates that, did the bare minimum, and I think that they got the minimum. But I also had classmates and friends that worked as much as they could work, made as many contacts as they could make, and tried to experience as much as they could. And that's when you really get your money's worth, because I mean, PA school is not cheap. And so if you're going to be there, you might as well go for it and get what you can out of it. But it's a wonderful experience. All of us, and I know during it can be tough to have that perspective, but on the back end, and even for me, being a PA this long, those were great years for me. I met some lifelong friends and made contacts that I still have. And and I think once, if any of you guys decide to go this way, it's a great career. In preparation for this talk, I did reach out to a bunch of friends that I have that work in academics and PA academics and new PA students that gave me kind of a list of tips that I'll post the PDF inside the chat so you guys can have the list of. These are just anecdotes and people giving information about what worked for them and what didn't, and little tips of advice that I think you guys could apply at different points of your training and your working career. So I'll post that in a second. But it's a great career, and I think that all of you will enjoy it if that's the way that things go for you. I think I'm passing it back to Rashada.
All right, guys, so I'm here to share some resources with you all. If you are looking for a mentor, or if you are completely lost and have no idea where to start in the process of applying, I am here to share a great resource with you guys. So I'm going to start with what I personally do. So outside of being a PA Monday through Friday, on the weekends, I get a chance to spend time with my mentees. I have a mentorship program called Dreams Inspire Life. And it is a program geared towards helping students figure out if PA school is right for them, and if it is, where to begin. And we kind of spend 6 months together We accept applications usually around Thanksgiving time for the first cohort. So we have two cohorts. One is called the pre-PA cohort or the pre-cohort, and the second one is called the post-cohort. The pre-cohort is for pre-PA students and non-traditional students. And you basically apply. People who follow me on social media or follow our website or sign up for our emailing list are alerted when applications open, when the cycle opens. And so you're able to fill out the application, which is usually a Google form. And then we go through the applications and everything, and then we accept people into the program. And it's basically an online based module type of program where you have videos and you have assignments to kind of work through for each month. The way the modules are set up on the first of every month, a module becomes available for you to kind of go through the topic for that month. And so for our pre-cohort, usually we begin with, of course, introductions, making sure you network, you mingle with other people who are on the same journey as you, which I think community is hella important because there's plenty of people out there that's right where you are. But for some reason on this journey, sometimes you do feel like you're by yourself a lot. And I know for me, especially, I was by myself because my mom was a nurse. I really didn't have a lot of people that I could talk to or ask advice for. So I felt like community was really, really, really important. So we created a Facebook group for the people within our mentorship program to mingle and stuff. And then the second month, which is the month that we're in now, for my mentees, we go through picking your top 5 schools, which I really feel like is important. I didn't say top 20 schools, I said top 5 schools. So really narrowing down what you're looking for, the tuition, if you're willing to travel, an established program versus a newer program, or if you want to do an accelerated program where you begin bachelor's with them and then accelerate on through master's or what have you. I felt like that was really, really, really important. And also to know what you're willing to take and what you're not. So for prerequisites, I know I wasn't willing to take biochem and I wasn't taking genetics. So I applied to all the schools that did not require those 2 classes because I wasn't having it. But it caught up with me because my first semester I had to take genetics. So it came back to bite me, but it's all right. So I had to, a lot of people don't know that every PA class or every PA program is different in what they require you to have and what they don't want you to have. The next month we will be working on personal statements, and then so on and so forth. We'll go through each part of the application. For our applicants that are applying this April, we actually take you aside. So they're still doing the modules and kind of going through what they already have and tweaking it. But we kind of go ahead and scoop you up from the beginning and go ahead and start looking over your personal statement and everything. So by the time CASPA opens in April, you're ready. But for all of the other people who are thinking about applying next year and so forth, that's in my program right now, we just get them to understand their why and understand the versatility of the profession. So we have PAs that are currently practicing that might volunteer their time on a Saturday to come through and do a quick presentation so they can understand that we can do any specialty. So I think that's really important that people know that. They know that they can switch specialties, but they don't know how extended this goes. So we can do anything. So I think that's really, really cool. And then the second part of our program is mostly one-on-one phone calls and stuff. And then the second part is the post cohort. So these are PA students that are gearing up towards clinical year, or they might be in didactic year, feeling discouraged. I'm not here to really make commitments, time commitments. There's no modules or anything for this. This is just basically support. So with any of our programs, with any phone calls or anything, you automatically get access to our Facebook group. So automatically you have that community. And then within the post cohort, we really just have support. Anytime you feel discouraged or anytime you feel like you're confused or don't know how to study, or if you just need some advice, I'm there to help. I know I don't want to put her on the spot, but Wane, she is my mentee. She's one of my mentees. So I know that when she feels discouraged or she's having trouble concentrating or anything, me and her talk, and we don't talk a whole lot because I know she's busy, but it's whenever she needs me. And then, for clinical year, some people program make them kind of flow out what rotations they want to do first, what their elective rotations will be. Some people need help deciding on that. Some people need people to look over their CV, give job interviewing tips, mock interviews for jobs, and tips like that. So that's pretty much what the second half of my mentorship program is all about. And it's 4 of us. My co-founder, Afnan Beauty, is currently a PA student at Emory and Henry here in Virginia. And so she helps me out. And then my other 2 mentees, Casey and Rabia. Rabia starts PA school in the fall, and then Casey is currently in Michigan. So we all 4 of us come together and I guess, give our time to help in the next generation of the profession and pouring into you guys. So when we get old, you can take care of us. So it will come full circle, I promise. So that's pretty much all about Dreams Inspire Life. We also have a website, dreamsinspirelife.com, if you want to check it out and learn more. But I'm here to share some other resources with you guys too. So I'm going to see if I can share my screen, and hopefully this works. Nope, I can't share it. It said the host disabled it. So I'm gonna just put in the chat. I'm gonna just put this PDF in the chat for you. And let me know if you guys can click it or see it. If you can't, I'm gonna find some way to give it to you. Oh, here go the file thing. Yes, okay. I'm just gonna upload it. Huh, I didn't know I could do that. Okay, so I'm going to upload it here in the chat. And on this PDF, it has books, podcasts, websites, Instagram accounts, YouTube channels. If it has everything on this one little PDF that I could think of and that all of us could come together and think of for you guys. If you think of anything else that need to be added to it and you want an updated version, let me know. But I'm going to put what I have in the chat in a second. And this wraps up my presentation or my couple of minutes with you guys. I'm still trying to figure out how to upload it, but I will here in a second. But thanks for listening to me ramble on. Thank you.
So we have such an amazing panelist, and they provided such a wealth of information. We have about a few minutes left, and we are going to try to get through some of the questions that are in the chat. If for some reason I've missed a question, please send it again. So I'm going to start off with the first question for the panelists, if the panelist is ready now for the Q&A. Okay. Right. So the first question I have is, due to COVID-19, a lot of places are not allowing shadowing in the offices. How would you recommend getting letters of recommendations from healthcare providers like PAs and doctors?
I'll just add my suggestion, and whoever else wants to add to that. I would say it is an adjustment trying to make connections and get shadow hours. Wande had mentioned, just brought up a very good point of making connections via social media, and already using the connections that you have in place. Professors may know medical professionals, and virtual shadowing is an option as well. And then also there are some practices and providers who are allowing students to come in and shadow. I know at my practice, we're allowing students to come in and shadow. So it's just about asking around and networking.
I know for my mentees there, I've been telling them like online, all the Instagram, it's a lot of Instagram accounts now, they're doing the virtual shadowing. And I don't think schools are really picky on whether they have to be PAs or doctors one way or another, but you can count those virtual shadowing as a attendance as towards your shadowing hours. There's even YouTube channels. One is called the Official Club Med on YouTube, and another one is Pre-PA Pals. If you go back and watch them, even the older videos, videos, you can still send them a message on Instagram, let them know you watched it, and then they actually are giving out certificates just as proof. So another thing I did when I was shadowing is I went into Microsoft Word and made myself a little chart, and I just documented it so I could keep up and tally up all of my hours, and I kept up with it that way.
Okay, any other questions before we close out? I'm only seeing a few, well, at least one question on my end. Are there any other questions for the panelists?
Yes, I had a question. I have a question.
Sure.
Oh, I can exit like out loud? I don't know. Can everyone hear me?
It's for the chat. If you could put your questions in the chat.
Right, so I sent it to you already.
Well, it looks like we've had some technical difficulties, so I probably didn't get the question. If you could resubmit it again, we'll be more than happy to see if we can get that answered.
I saw one question in the chat earlier in regards to patient care hours and healthcare hours. Someone asked, are both of them required for the application? To my knowledge, the direct patient care hours are the hours that are necessary for entrance into, for acceptance rather, into a PA program. Healthcare hours are just kind of like maybe a cherry on top or something that you can do additional, but what's kind of like a mandate requirement are definitely the direct patient care hours. If anyone wants to add to that, feel free.
Yeah, so I would like to agree with Jamaica. For the most part, you need patient care hours. They want to see that you know how to interact with patients. That's not something that is new to you. But there are some programs, like the program that I currently attend, they count both healthcare and patient care hours as the same. So you could have just been a medical receptionist. That's all you did. They will count that as both. But then there's other programs I applied to, got interviews for, where there is a separation, there is a requirement of certain hours. So you just have to do your research for the schools that you're interested in applying to.
Okay. Excellent, excellent. So the next question that we have, and briefly before we are needing to end, what are some advice you have for students with low science GPAs? What are some advice that you have for students with low science GPAs?
I have a couple of thoughts. One is, are there opportunities for you to go back and retake some of those courses and try to increase your grade? And then also, GPA is very important. A science, having a 3.5 and higher science GPA is important, but it's not a deal breaker as well. And so if your application has other very strong supporting pieces, like your extracurricular activities, your personal statement, your GRE score, your shadowing experience, or what have you, those things help to boost your application up. And Wanda had mentioned earlier, if you feel like you don't have a very strong application, apply early. Because if you have those other things, that gives them an opportunity to look at those other things as a holistic view, as opposed to just your science GPA.
Awesome advice. Awesome advice. Here's another question. This is for, I have international students here, and we talked about what that might, I'm sorry. So it looks like the question is, I have international students here, and we talked about what it might mean in preparing today's lesson. So could someone kind of get into depth of what that would mean for the listening session, and what first in the family would mean for a lot of different people.
Can you
Would you like me to?
Yeah.
Sure. So I think the way the question, and it's a lot here, I don't know, there's some missing words here, but the question is essentially for international students, and some of them wanted to know what that might mean to be first in the family, because that's a topic of the panel discussion.
Oh, sure. So the significance of first in the family is quite, like, honestly, breaking barriers, being able to afford opportunities to go into a career that impacts lives directly here within your profession, being able to have a career where you generate income and you have financial stability. And then also being first in the family means that you are an example. You can lead. If you have other family members, younger family members who want to pursue a career in medicine, then they have an example, they have a resource, they have a mentor. So that's my kind of explanation and definition of, or significance rather, of what it means to be first in the family.
Right. And if I can add to that, because, you know, there are, and I would say that would apply with the PA program, but that would also apply with a lot of different programs when it's something new to be first and to have certain barriers that you may not have seen examples throughout, you know, your childhood experiences or even your young adult experiences. So excellent question. I believe we have time for one more, but before we get to that question, would the panelists be interested in providing maybe contact information that perhaps they could reach out at a later time if they have questions about some of the things that were discussed today?
Yes, I can be found on Instagram at BlackDermPA. And then also my email is blackdermpa@gmail.com. So it's blackdermpa on IG, blackdermpa@gmail.com. And I see Rashada putting her IG handles in the chat.
All right, awesome. Last question, would HCE from before college count? Would HCE from before college count?
Yes.
Okay. The answer is yes to that question.
And this is Laurie. I work with the PA program at SIU, and we do have families or students who are immigrants who have who are now legal residents and have gone through our program. So to answer that question just quickly. And they could contact our program and ask more questions if they wanted to.
Okay, awesome. Thank you, Laurie. Laurie, did you also mention some of your information to the program in the chat?
Yes, we can go ahead and Elise is here with the program too, and she'll go ahead and put some contact information in the chat. And we also put a link to the problem-based learning video there so they can learn more specifically about the way our program does problem-based learning, because it's very unique to the learning style. So you'd want to know if you wanted to actually learn that way. It's very different. So
Okay.
we're really glad to have this group here tonight. Thank you so much.
So thank you everyone for joining in, and special thanks to our panelists who provided a wealth of information. As we discussed, if there are some questions that we were not able to answer today, please feel free to reach out to the panelists and they should be able to answer some questions that you may have. Thank you so much, and I hope that you all have a good night.
Bye.
Good night, everyone. Thank you for
Good night. Thank you.
to come out.
Thank you, guys.
Good night.
Good night, everybody. Thank you so much for sponsoring this.
Thank you, Laurie.
Bye. Good to see y'all.
You as well. Bye.